for those of you who, I think we all know each other here, but my name is Jimmy Keefe. I'm one of your county commissioners. Chairman Evans also appointed a committee to work through the American Rescue Plan funding. So I was pretty honored to be the chairman. Also on our committee is our vice chairman, Commissioner Glenn Adams in the back, and Commissioner Tony Stewart right here in the front. So the whole idea behind this program is to get citizen input. This is our fourth public forums of sorts. And so as most of you know that are here, there are limitations to what you can and cannot spend with the ARP funding. More detailed guidance is coming down every single week, but I think we're finally starting to get a little bit of a handle on it. So the agenda that we're going to be working with now is I'm going to be followed by our mayor of the city of Fayetteville, Mitch Colvin. Our county manager, Amy Cannon, is going to go over our limitations or do's and don'ts and what we can spend on it. We're going to have some comments from the city manager, Mr. Hewitt, and then we're going to have what we have is a little bit of a survey. If you're a member of the public or an elected official that's being represented, you should have a clicker with you, and we're going to try to get some feedback that way, and then we'll have some opportunities to get a little bit more detailed. So that's all for my comments. Mitch, you want to come on up?
Thank you, Commissioner Keefe, and certainly before I have any comments, I'd like to say happy to be joined by Mayor Pro Tem Jensen as well as Councilmember Kinston and our fine staff at the City of Fayetteville. So thank you, County, for allowing us to be a part of the discussion. On the city side, we committed to respecting each other's family time and private time during the month of July. However, we've still been in touch with the various members of council and the management, and we kind of mirrored your process to where we had a few council members who were appointed to attend some of these listening sessions to bring that back. And when we reconvene next week, the thought is to discuss with council the option of setting up subcommittees, a similar structure that we used during the original CARES Act funding, which helped set policy framework in place for different categories. And so this is a discussion we'll have with the various council members and the manager to talk about how we can best give policy advisement to our staff to cut down on any of the delays or the bureaucracy, to make sure that the resources reach the people, because I think that was the intent of all of this, is to make sure that it stimulates and rebuilds communities that were impacted. So look forward to the conversation. Thank you.
Okay. I'm going to be followed by the county manager, Ms. Amy Cannon.
Thank you, Commissioner Keefe. And again, I'm Amy Cannon, the county manager, and thank you for your time this evening on a very important topic. This is going to be an interactive session. This is your opportunity to share your feedback about how you believe the county should allocate this American Rescue Plan funding. I've said this in other sessions, my part is the most boring part because I'm going to tell you about Treasury guidelines. But I think it's important that you understand what the eligible uses are so that you can, that will assist you in the decisions and in the interactive session. So I'll try to go through this fairly quickly. And so, as many of you know, it's been almost 18 months since we had our first case of the pandemic, and it certainly has changed every part of our lives. We first learned new terminology and social distancing, and then schools began traversing to remote learning. Businesses closed, employees began working from home. And then finally, we have had an economic shutdown, and millions of jobs were lost because of that economic shutdown. On March 11th, 2021, President Biden signed into law the American Rescue Plan Act. These funds are intended to reimburse states, local governments, territorial and tribal governments for their actions to mitigate the spread of COVID-19 in our communities. And so here are just a few key guidelines about those funds. Eligible expenses for the American Rescue Plan are from March 3rd, 2021 through December 31, 2024. The funds have to be obligated or encumbered by December 31st, 2024, but you have through December 31st, 2026 to spend those funds. Now I'd like to review the eligible categories, and the first one centers around public health response. The need for public health measures will continue for months and unfortunately maybe at least for a year or more. I think each of us are hearing on the news each and every day about the Delta variant and the rising number of cases nationally, but also unfortunately in our own community. Resources from a public health perspective are going to continue to be needed for vaccination clinics, for contact tracing, but also to continue education to mitigate the spread of the virus. COVID-19 has affected every aspect of how we live physically, but I don't think we should forget the mental and the emotional stress that COVID-19 has created. And from a behavioral health point of view, these funds can be used for that perspective. As an example, the number of suicides and overdoses related to substance abuse has gone up dramatically during the last 18 months. These funds also are allowable to be used for public health planning. And so a lot has gone into preparing for this pandemic really on an ongoing basis. But there are other public health issues and events that we need to be prepared for. And finally, from a public health perspective, each of us have been impacted, but we must not forget that there's certain demographic groups or communities that have disproportionately been negatively impacted by COVID. And so this funding can be used for those individuals or communities. The next category addresses the negative economic impact caused by the public health emergency. As you know, this pandemic has created significant economic and financial hardships. Although many jobs have been restored, many jobs have not nationally and locally. And so this funding is intended to assist households or populations that have been impacted, and they may need help with rental assistance, they may have food issues, mortgage issues, or utility issues. In addition, many small businesses have been negatively impacted. We've lost a lot of small businesses, but these funds are out there to assist small businesses as well as nonprofits that provide key services in our community. And finally, the funding is eligible for certain sectors of our community. As you remember, when we had the economic shutdown, tourism was shut down for an even longer period of time. That was evidenced by our occupancy tax collections. For many months, those collections were hundreds of thousands of dollars less than they had been the year before. The next category centers around premium pay for essential workers. So you might ask, why did Treasury submit that as an allowed use? Throughout the crisis, many workers, essential workers, have put their own health and well-being at risk to continue to serve communities in hospital settings or in vaccination clinics as our public health workers have. I think we also need to remember that many of those essential workers may be in some of those disproportionately impacted groups. Many essential workers are those that may be on the lower tier or pay scale. So because of this, the premium pay is intended to compensate these essential workers for putting their own health and well-being at risk. The next category is investment in water and sewer. And Congress included this category because they understand how important and critical clean water and wastewater treatment systems play in promoting public health and safety in our communities. Many of you know that we have many citizens on wells, we have contaminated wells, and we have many failing septic tanks throughout our community. So this is a key category for consideration for our community. The next category centers around investment in broadband. And certainly the pandemic has highlighted the need we have for high-speed, reliable, but affordable broadband. Many families were at a significant deficit because they didn't have access or they could not afford broadband. There are many school children that were never able to sign on. Businesses relied on broadband to send employees home so they could work remotely but safely and mitigate the spread of the virus. And many medical providers had online or telehealth visits. So this is another eligible use. The next category centers around public sector revenue loss. Many local governments across the United States were not as fortunate as Cumberland County. We are a resilient community, one, because of the presence of the military component, and their salaries were not impacted. Our local sales tax actually performed very well during the pandemic. And so replacing public sector loss is not a critical component for our community. And finally, the last category, again, focuses on those equity services. The Treasury has put great emphasis on equity-focused services. This funding, again, is available to address those communities or demographic groups that have been disproportionately impacted. And so many have greater health disparities today than they had before the pandemic. Many have significant housing issues. And again, we can't forget the educational disparities that have occurred during remote learning, where many children were not able to keep up with their education during the pandemic. And so at this point, I'm pleased to turn this over to my counterpart, Mr. Doug Hewitt from the City of Fayetteville.
Thank you. Thank you, Amy. And I want to thank the county as well for allowing the city to participate in this meeting tonight. We're playing a little bit of catch-up, as the mayor mentioned. But the City of Fayetteville is happy to participate tonight. And while we're here today to talk about the American Rescue Plan Act and the $40 million that the city was allocated, I'd be remiss if I also didn't say that the city, along with the county, had been given significantly more funds. And it's our hope on the city side that we'll be able to use the American Rescue Plan Act as well as the CARES Act money that came before and emergency rental assistance funds that came to use this as a once-in-a-lifetime opportunity to really jumpstart a lot of initiatives that we have and needs that we have here in our city and in our county. All told, the city is on the screen, received $40.4 million in ARPA funds. But when we total it all up, including our CARES Act funding, our ERAP, home allocations, money that we got directly to transit and the airport, the city stands to receive more than $74 million in total. And that is a significant amount of money. And again, while we're here tonight to talk about the American Rescue Plan Act, I would be remiss if I also didn't recognize Councilmember Chris Davis, who joined us just a moment ago, He and the Mayor Pro Tem Jensen, as well as Councilmember Yvonne Kinston, and others served on a variety of committees last fall that helped us get some of the CARES Act funds out to many of our at-risk businesses. I'm happy to say that they were able to save and retain, that we are able to document more than 214 jobs through their efforts with that. And so if we were able to do that with just under $600,000, imagine what kind of good we're going to be able to do with $40 million. But in order to make sure that we spend this money, this once-in-a-lifetime money, where it's needed most, and to make sure that we cross all of our T's and dot all of our I's, we've actually engaged a firm, iParametrics, and Mrs. Burks is here with us as well. She's going to be our lead consultant in this effort. And we're hoping that through her work and the work that we have with our federal lobbyists, as well as from interactions we hope to have with our citizens who are here tonight and the council, that we'll be able to identify what is the most appropriate use of that $40 million while taking into account the fact that the federal government will also be sending out significant monies by way of grants. And so as I was talking to Commissioner Keith before the meeting got started, if we're able to use someone else's money as part of a grant from the federal or state government and supplement that with either the city's money or the county's money, that allows those dollars to go even further, and that's what we hope to do. We also want to support the application, as I said, of state and federal grants, and we hope to not only have this session tonight with the county, but as we gear up and the council comes back off of their summer break in August, we'll be working with our paramedics and our community development staff to be looking at other more targeted community and citizen input sessions that will allow us to go into some of those areas, as Amy mentioned, some of those historically disadvantaged and underutilized communities, and those that were most impacted. I can tell you that on the city side, if they were to, the council were to allow me to wave a wand, and I'm sure Amy would say the same with the county commissioners, we would be able to identify how to spend that $40 million probably in 15 to 20 minutes. But that is the beauty of the work that we do down here. It's not just what we have in our head, it's also getting feedback from the citizens who are here, and it's really good to see that we have several here. And so I'm going to hush and allow Dr. Angel Wright-Lanier and Sally Schutt to come up and walk us through the citizen input portion that we have tonight. But again, thank you for allowing us to participate.
Good afternoon, everybody. I want to make sure that you each have a clicker with you and a notepad, some post-it notes and a pen. So if you don't have a clicker, will you please raise your hand and we'll get one? All right, looks like we're all set. Okay. All right, so we're going to start before we move into the questions that are a part of our survey. We just want to make sure you're familiar with how the clickers work. So our first question is, you are in a race right now. What place are you in when you pass the person who's in second place? A, first, B, second, 3, third, or none of the above? Everyone had a chance to vote. All right, Al, let's get the results. Wow, 86% said first place, 7% second place. The correct answer is you'll be in second place. If you pass the person who was in second place, you're now in second place. All right, now we want you to rank, because while we do the survey, you're going to be ranking some questions. All right, so list in order of your favorite foods. They're there. You've got several options. Rank your favorite cuisine. List your favorite ones first. Caribbean, Thai, Mexican, Chinese, Southern, or Italian? There's a lot of concentration going on.
It's dinner time.
I know. Okay, let's see what people like to eat around here. E, Southern is the leading vote getter, followed by Caribbean, Mexican, Chinese, and Italian. They're all neck and neck there. Okay, the least favorite seems to be Thai. All right, now we get into the serious questions.
You were going to do one.
Okay, I'll do question number 1. Please rank the funding categories that the county manager has just reviewed in priority orders of importance to you. Select the appropriate letter in the order you like, okay? So A, support public health expenditures. B, address negative economic impacts. C, provide premium pay for essential workers. D, investment in water and sewer infrastructure. And E, investment in broadband infrastructure. So please rank these in your order of importance. Does everyone have a chance to vote? We'll give you a few more. Okay. So the results are supporting public health expenditures, followed by addressing the negative economic impacts, investment in water and sewer, investments in broadband, and then premium pay for essential workers.
All right, so for question 2, please rank the following examples of programs and services designed to address the public health impacts of COVID-19 from 1 to 4, with 1 being the most important and 4 being the least important. A, services and programs to prevent and mitigate and respond to COVID-19. B, enhance behavior and mental health services. C, improve the design and execution of health and public health programs to address needs. And then D, to address disparities in public health outcomes. Rank those in order of importance, please. And I'm not going to promise you that I'm going to be able to see the results. Okay. All right, A27 and B27, the next 24 and 23% for D in last place.
All right, question number 3. Please rank the following examples of programs and services designed to address the negative economic impacts of COVID-19. A, assistance to households, food, rent, utility, case management, home repairs, job training, etc. Assistance to small businesses, assistance to nonprofits, and then A, to impacted industries. One through 4, rank those. All right, let's see the results. 30%. B, assistance to small businesses, followed by assistance to households, assistance to nonprofits, and then A, to impacted industries.
All right, question 4. So please rank the following examples of programs and services designed to address disproportionately impacted communities from 1 to 4. A is services to address homelessness. B, affordable housing development. C, addressing educational disparities magnified by a public health emergency. And 4, promoting healthy environments for children. Please rank from 1 to 4.
Okay. Oh, boy. Okay, B is 27%, the affordable housing development. C, 26, D, 25, and then last place is A, services to homelessness.
All right, please rank the following types of infrastructure projects. A, public water projects to address access to clean drinking water, provide public sewer to address septic tank problems, projects to improve resilience of infrastructure to severe weather events, and broadband infrastructure to unserved or underserved communities. All right, let's get the results. Well, two are a top priority, public water projects to address clean drinking water and projects related to resilience for severe weather events. And then the other two are very close as well, the public sewer and broadband.
All right, so question 6, we want to do something a little different. We're going to ask you all to take the yellow pad that you have and answer this question. Are there any additional programs, services, or projects that the county should consider for the ARP funding? So if you would do that after you scribble down your choices, the things that are most pressing to you, we'd ask you to come up front and put them on either this flag or that one. So we'll give you a few minutes to do that. Go ahead, Sally, I'm sorry.
Yeah, if you need more Post-its, we have plenty, so you can use those. As many responses as you would like. come up, pick one up if you don't want to get up and, all right, let's, go ahead. Dr.
All right, so, thank you, Sally. Substance misuse treatment, services for senior citizens, enhance and improve healthcare system, education on mental health, child care grants for qualified parents payable to the provider, another one that says child care, community information podcast, health department, and then improve the healthcare system.
Okay, services to children, child care, and after-school care. For homeless families, yeah, services for homeless families and housing for homeless families and individuals. Homeless Day Center, school improvements, move E.E. Smith High School, water utility, county-wide services, underwater utility. That's together. More strategically targeted curriculum to address unskilled/skilled career options. Expand preschool access. Build 3 new high schools to focus on innovation, science, and coding. And the final one is county-wide water. All right, so now the next questions, you've shared a lot of ideas with us. We want to learn a little bit about you, so we've got some demographic questions. These are also on the survey that's online. Are you a Cumberland County resident? Yes or no? Okay. Okay, let's see. Everybody's Cumberland County resident.
Question 8, if you live in the city of Fayetteville, please select your zip code. Let's see.
I'm going to look at your printed product there.
Okay, let's see the results. All right, H has the majority.
28311. North side. 28314. Yeah.
Okay.
All right, did the other options within Cumberland County, so if your zip code wasn't posted there, please let us know your zip code. Okay. 28306.
All right, has the COVID-19 crisis negatively affected your family financially? A is not at all, B is very little, C is somewhat, and D is severely. Please choose one. Okay, Al? All right, C, somewhat, followed by D, severely, and then you see the others. All right, question 11.
Do you have access to affordable high-speed broadband at home? Yes or no? Affordable high-speed broadband. All right, the results are 80% or 79% yes, 21% no.
What is your relationship with Cumberland County? A, you live in Cumberland County, B, you work in Cumberland County, or C, both? Okay. All right, C, both, followed by A, live in Cumberland County.
Do you own or operate a small business in Cumberland County? 64% on this, no, do not, 36% on, sorry.
All right, are you connected in some way to the military? A, yes, B, no. Okay. %54% no, and 46% yes.
Similar question, are you a veteran or a spouse of a veteran? Are veterans or spouse.
Okay, are you affiliated with a nonprofit organization that provides services to citizens who have been negatively affected by COVID-19? A, yes, B, no. A, 64%, B, 36%. Sally gets the fun question.
Yeah, I do. How old are you? We have ranges. Under 18, 18 to 34, 35 to 54, or 55 and over. Okay. No, well, everybody's over 5, and most are between 35 and 54. 62%.
All right, question 18. Most people think of themselves as belonging to a particular ethnic or racial group. How do you identify yourself? A is African American or Black, B is Asian or Asian American, C Caucasian, white, D Latino or Hispanic, E multiracial or multi-ethnic, F Native American, G Pacific Islander, H other, or I prefer not to answer. Okay, 57% African American or Black, and the next highest category is C Caucasian or white.
Would you like to receive information through a newsletter or emails about Cumberland County government activities, services, or programs, yes or no? Okay. 86% yes. All right, so now, before I hand the microphone over to Commissioner Keith, we just want to remind you about the online survey. If you will, please let your friends and neighbors and people within the organizations that you're a part of know. The online survey is on our website, cumberlandcountync.gov. We are closing that Saturday, so please push out that information so we can continue to gather feedback. We are having a session Thursday, which will be a virtual session, so anyone who didn't get to participate tonight or in our earlier sessions, you can log into slido.com, and there's the entry code. I know the city the county pushed out the information, the meeting announcement. We'll be sending out a press release tomorrow. It's on our website. It'll be on our website in the morning. So that's the login information. And if you have any questions, you can send directed toward the county. You can send them to arp@co.cumberland.nc.us.
Thank you, Sally. And I appreciate everybody coming out tonight. This feedback is very important to us. Without it, we don't have the voice of the public as we go through. I think at last stand, we've only got about 400, a little over 400 surveys in. Please encourage people over the next 2 days to make their voices heard and to let them know that this survey is available and that we're going to take these results and we're going to present them and hopefully come up with a plan that is beneficial. I hope you guys got a lot out of this tonight. We certainly have over our fourth meeting. Please also encourage people to attend the virtual meeting on Thursday night if they are able, and we look forward to seeing you. Some of the staff will be available for a little while after we close this presentation, so if you'd like to stay and ask some questions, please do. Otherwise, Mr. Mayor, thank you for your group coming out, all the city council members also, and thank you for the committee members and our staff. Thank you very much. This concludes the meeting.